So what I tend to do with the way I approach this from the design perspective is I try to really look at how can designers become advocates for communities at the sort of beginning of this thing, because healthcare providers and caregivers are really good at addressing the outcomes of these situations, but they're not usually in the room at the beginning of it. They're not the ones sitting in the city planning meetings deciding what goes where and how that's all distributed or even the design of the spaces. It's really where architects and designers have a role to be advocates for communities in those situations. So how can they reach out to the community in a participatory way, in a collaborative way, to get community insights that allow the places to be designed kind of with and for the community instead of a few steps removed. But then also how do we close those gaps, and how do we start to get designers and community members and healthcare practitioners into the same room to talk about both ends of that spectrum?
Kansas State University and K-State Research and Extension's work shows how efforts at the community level are crucial to improving people's health by focusing on social determinants of health, health equity, and health literacy. Today we'll hear about how place, the social determinants, and health, mental, physical, and social, are all connected and impacted by the places where we live, work, and play. On today's Sound Living, Place-Based Health. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. Kendra Kirchmer, an assistant professor in Kansas State University's Department of Interior Architecture and Industrial Design, says your zip code is a better determinant of health outcomes than your genetic code. Kendra, we hear a lot of discussion about social determinants of health, and really part of your focus is looking at that, but doing it from an architectural perspective. So how do those two, intertwine?
Yeah, thank you. I think that's a great question, because I think when we think about health, we most often think about our genes, cells, and biology as what really determines whether or not we're healthy. And I think I should back up just for a second and also talk about health in a bigger picture, because I think we also tend to think of health as just, not being sick and not having an injury. But really, health is a much bigger picture. And if we look at the World Health Organization's definition, it has to do with a complete state of being that includes physical, mental, and social well-being, not just the absence of, sickness and injury. And so thinking about that bigger picture of health, it's pretty easy to see that it's not just our genes that are determining that, or necessarily even our access to high-quality health care, but it's also our behaviors throughout every day, the physical environment, and our social networks that contribute to that other 80%. And within that, and what determines the sort of quality of those things, is often the social determinants of health, which can be both good and bad. But generally, we tend to talk about social determinants in the sort of negative impact on health outcomes. But those include, your access to healthy food, or your ability to find a high-paying job, your ability to get there via transportation networks, again, that social infrastructure and your access to community groups and other people who share your same views or that you can, reach out to in a time of need. And also, the physical environment is a part of that in a lot of different ways. The built environment specifically, all the things that we construct, our cities, our urban planning, all the way down to the rooms that we're in each and every day, really influence that directly in their quality, if it's a healthy space or an unhealthy space. If, we have access to clean water, we can see easily how that impacts health outcomes. But then additionally, when we're looking at the way in which the design of the built environment, either intentionally or just accidentally, influences how we go about our day. You're not going to be able to go for a walk recreationally if there are no sidewalks. If you live in a really rural area, you're going to have to walk on the road if you want to take a walk or walk through a field. Or in cities, if there's not good lighting or the parks aren't safe, it's very difficult to get outside and just go for a walk. Or when you look at food deserts or food swamps, a lot of cities have issues with being in food deserts, as well as rural communities. They're losing more and more access to healthy food options. And so if you don't have access to affordable, healthy food, how on earth is one supposed to, eat that every single day? And time's a factor as well. If you're working more than one job, how do you find the time to really, devote 2 hours to meals or, diverse family units? People don't all like the same thing. So there's all these different factors, and the built environment is either kind of the foreground or the background to a lot of those choices. And sometimes it's subtle, and sometimes it's much more overt in the way that it's impacting what we do.
So communities then, you think, can find ways to bridge that gap?
Yeah, absolutely. And so what I tend to do with the way I approach this from the design perspective is I try to really look at how can designers become advocates for communities at the sort of beginning of this thing, because healthcare providers and caregivers are really good at addressing the outcomes of these situations, but they're not usually in the room at the beginning of it. They're not the ones sitting in the city planning meetings deciding what goes where and how that's all distributed, or even the design of the spaces. It's really where architects and designers have a role to be advocates for communities in those situations. So how can how can they reach out to the community in a participatory way and a collaborative way to get community insights that allow the places to be designed kind of with and for the community instead of a few steps removed. But then also how do we close those gaps, and how do we start to get designers and community members and healthcare practitioners into the same room to talk about both ends of that spectrum?
Is that kind of where we see most communities now, when you're building a new subdivision, are requiring sidewalks? They're requiring those pathways.
Yeah, absolutely. And I think it's always interesting because, from the design perspective, we've known for a long, and we learn more every day, but we've known for quite a long time a number of things that we need to do as designers to make healthy places and to make places that foster equity and community and help build those kind of social networks. But it's difficult to get into the right moment and the right place at the right time to really advocate for that, across the board. And so different cities have more or less zoning requirements and things like that can advocate for it. And so there's always this dialogue between architecture and policy. I think that's what's so neat about some of the outcomes of the recent years is that more and more people are realizing that everyone has these expertise in different areas, but it's really about bringing it together into one place that you can start to realize that we're all tackling it, but we can't complete the picture alone. And so, yeah, there are policies that advocate for even complete streets where they're building subdivisions that require bike lanes and other things to promote just active transportation because it really is healthier. And it's also good for the environment not to drive cars everywhere. And so how do we get to do that in a way that's more evenly distributed? Because right now it tends to be located in cities that already sort of have that social infrastructure in place. But then when you don't have that, either, kind of in denser urban cores sometimes or in more rural areas, there isn't that infrastructure in place to give people that voice and to kind of say, no, we have to have sidewalks. We have to put in bike lanes so that people can bike. We have to put in benches in the parks because people need to sit. And all of those things go together into kind of this complete picture. But it's about finding who can be the advocate and how to kind of mobilize the groups of people that need to be mobilized onto transdisciplinary teams to do so.
And a lot of this are public spaces. We're looking at libraries and things like that where people could meet. But part of that is not only is it a place for them to meet, but is it located where it should be? Is it something that they will feel safe using? That sort of thing also comes into play?
Yeah, no, absolutely. And I'm so glad you brought up libraries because libraries are so essential for this because they're free. It's a place for community members, young and old, to gather and to have some of these informal meetings. But even the sorts of community serving establishments, are there banks? Are there laundromats? Are there beauty salons? What are the businesses even in that area? And you find that, again, this is another one of the sort of interesting connections between really dense urban cores and some rural areas is both are missing those services sometimes, and they end up being located, in the case of rural, in a more populated area, or in the dense urban cores, in more affluent areas. And so finding those public spaces where people can be, where people can come together is critical, either indoors or outdoors. And then how to encourage the design of those to be inclusive and welcoming so that people really feel like they do belong there. How to make sure that someone from the outside of a building knows that they're welcome is something that we talk about all the time in the courses I teach.
It's interesting because there are places that we spend so much of our time, home and work primarily.
Absolutely.
That can be, basically your whole day is either work or at home. And are there things that we can do around the home? Are there things we can do around our workspace that will maybe have a better impact on our health?
Oh, absolutely. I think the phrasing is always where we live, work, and play. And sometimes I add learn into that because we're at K-State, so it makes sense. But yeah, so, and work environments are tough because we typically have much less control over where we work. And also we don't always have control over where we live, especially in rental situations. But, definitely understanding how to create quiet spaces as well as spaces that facilitate, group dynamics in a home setting. So it's really important that people have both a place to gather, but then they can step back and, be a part, but not have to be in the sort of activity if they don't want to. Giving kids a place to sit down and do homework is really important. And also making sure that the basic needs are being met of the different environments. Like when I always think about how to explain the importance of kind of well-being at the top of a pyramid, you have your basic needs. It needs to be watertight, it needs to have basic heating and cooling. All those things need to be there. But then you have this idea of comfort, and comfort is very individualized. And so, thermal comfort is, as I think everyone who works in an office building probably is aware, is never good for anyone. It's always either too hot or too cold or everything in between. And comfort is particularly tricky because it's individual and it's durational. What's comfortable for one person 1 minute might not be comfortable for them 10 minutes later. So it's trying to create systems that control that at a larger level is a tricky, thorny problem. But, so thinking about the home is actually a little bit easier to solve because we usually have control over the majority of that. So once you get through the basic needs and the comfort, then you really have that idea of well-being. And how do you then bring things in? There's lots of interesting things going on with a type of design called biophilic design, which looks at the way in which you can take advantage of how much people love nature to kind of help foster spaces that promote more opportunities for well-being. So, bringing in plants, as long as you're not allergic to them, or your pets or your children, or, making sure that you have views to the outside and that those views are, if at all possible, pretty good views. It's not enough for it to just be a view out, although that is helpful, but to also have a view kind of into a natural setting is incredibly important. Access to daylight is critical. We exist in a world that has, kind of daytime and nighttime, and it's particularly difficult when we find ourselves in environments that don't let us have any connection to that. It tends to mess with our sense of well-being, among other things, and productivity and all sorts of interesting outcomes from it. But again, there's no one-size-fits-all strategy for what you could do at home. But I think, there's lots of little things. And I think it would be one of the most important things, especially in the home environment, would be kind of being reflective, taking a minute in the space and trying to assess for yourself, what about this is making me feel good right now? And what about this is not? And it can be as simple as clutter sometimes.
Yeah, ironically, a lot of people made changes when we started having to work from home. We decided that this is okay as a home, but if I've got to work here, I need to make some changes because I can't be clearing off the dining room table at the end of every day. So there are some things that we do out of necessity, but some other things that really make sense because it does make our life better.
Yeah, absolutely. And I think it's been interesting when everyone has gone back to working at home. And it's something that we talk about a lot in the design fields that I'm a part of because we do a lot of workplace design. And there's we've built as a society, a lot of office buildings that are, only kind of half occupied right now because people went home and you don't really have that quiet space. One thing that the office is really good at is providing a space dedicated to that work task that doesn't necessarily, have cats running across the Zoom, dogs barking, all of those accidental outcomes that we associate with home, but at work. And so really it's been interesting for the past year or two trying to examine what it is the office provides as a value add versus the home for working. There's definitely that idea of collaboration because very few jobs are better performed, sort of isolated and alone. Typically, it's helpful to be able to talk with other people who are doing the same job that you are. So there's always that. But Zoom kind of maybe does work sometimes for that, but it's also not as effective for the casual conversation and the things that you miss just by walking by a colleague and, seeing what they're working on, asking about it and learning more and how that influences then what you're working on yourself. So there's that, but then there's also that dedicated space that's designed to support the work that we do. And, I think that there's a balance in there between fully remote and fully in person. I think that people also did enjoy that flexibility of time because one of the other aspects of all of this is the time. And so, if you're living in the suburbs and you're working in an urban area and you're commuting 2 hours each way, that's definitely impacting your ability to do things outside of work that might be extremely healthy, like, go for walks, go to the gym, play basketball with your friends, or something like that. Or even, the time that you're going to spend trying to make healthy food, because it is unfortunately the case that unhealthy food is much faster more often than healthier food unless you're just, going to eat it raw.
And really the bottom line here is trying to make it better for everybody so that we are catching things upstream instead of downstream.
Yeah, absolutely. It really is about that upstream-downstream connection. And how do we make sure that the people who are seeing the downstream outcomes are able to communicate what those are to the people who are working upstream? Because as the designers, we typically are upstream. How do we know what we need to watch out for? How do we know what the problems are? And that's really, in some ways, through that connection back with, the care providers and understanding really deep analysis using, social sciences and health professions and design and, policy and just anything, as well as community, always community as well. Because I think you have to bring in the actual people that you're trying to design for in order to really come up with a solution that fits them. Because I think that it's that one-size-fits-all approach and that sort of distant approach that has resulted in some of these problems that probably were not ill-intentioned, but just misinformed because they weren't working with all the information because they didn't have all the different disciplines.
That's Kendra Kirchmer, an assistant professor in Kansas State University's Department of Interior Architecture and Industrial Design. To learn more about healthy living, contact your county or district extension office. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.